Welcome to this YouTube channel. In this video we are going to talk about the 10 signs of cancer mostly ignored by women. So before starting this video, like this video, and subscribe to our YouTube channel for future updates. According to research and researchers, women are more diligent than men in having prescribed health checkups and cancer screenings. According to Mary Daly, MD, oncologist, and head of the Department of Clinical Genetics at Fox Chase Cancer Center in Philadelphia, they're much more willing to get potentially concerning symptoms checked out. However, this is not always the case. Younger women, for example, are more likely to dismiss signs that may indicate cancer. They think cancer is just a concern for the elderly, Daly tells WebMD. They're always right, but cancer strikes young people as well. Of course, some women are just as adept at flipping to denial mode as men. There are patients who willfully neglect their cancer symptoms, says medical oncologist Hannah Linden. She is an associate professor of medicine at the University of Washington School of Medicine in Seattle, and a joint associate member of the Fred Hutchinson Cancer Research Center. She says it's typically denial, but not always. There is a cultural misconception that cancer is incurable, so why go there? Says one patient. According to Ranit Mishori, MD, an assistant professor of family medicine at Georgetown University School of Medicine in Washington, D.C., discussing troubling symptoms does not cause people to overreact. I don't want to give the impression that people should be looking for anything, she says. With that healthy mix between denial and hypochondria in mind, WebMD asked experts to discuss signs that might not necessarily cause a woman to be concerned about cancer but should be investigated. Watch this video to learn about 10 potential cancer signs that women frequently overlook. Number 1. Weight loss. That isn't clarified. Many women would be ecstatic to lose weight without exerting any effort. However, unexplained weight loss, such as 10 pounds in a month without increasing exercise or decreasing food consumption, should be investigated, according to Mishori. Unless proved otherwise, unexplained weight loss is cancer, she states. Of course, it may be something else entirely, such as an overactive thyroid. Expect the doctor to perform thyroid tests and possibly order a CT scan of various organs. Mishori advises the doctor to rule out the options one by one. Number 2. Bloating. Since bloating is so normal, many women simply accept it. However, it may be a sign of ovarian cancer. Some ovarian cancer signs involve abdominal or pelvic discomfort, feeling full rapidly even though you haven't eaten much, and urinary issues, such as an immediate need to use the restroom. If you're experiencing bloating almost every day, and it's been more than a few weeks, you should see a doctor. Expect the doctor to take a thorough medical history and, among other things, prescribe a CT scan and blood tests. Number 3. Breast changes. Even if they don't do routine self-exams, most women are familiar with their breasts and know to check for lumps. However, this isn't the only sign of cancer in the breast. The presence of redness and thickening of the skin on the breast, which may suggest inflammatory breast cancer, a rare but severe type of breast cancer, should also be investigated, according to Linden. If you have a rash that lasts for weeks, you can see a doctor, she advises. Consult your doctor if the appearance of your nipple changes, or if you find discharge, and you aren't breastfeeding. It's not a positive sign if it's usually outgoing and then turns in, she says. It's not a big deal if the nipples are inverted all the time. It's the shift in appearance that may be a cause for concern. If you have breast changes, your doctor would likely take a thorough medical history, examine your breast, and prescribe tests including a mammogram, ultrasound, MRI, and possibly a biopsy. Number 4. Bleeding in between periods or any unusual bleeding. Premenopausal women have a tendency to neglect bleeding in between periods, says Daly. They also appear to dismiss gastrointestinal bleeding, mistaking it for their time. However, she advises that between-period bleeding, particularly if you are usually normal, should be investigated. Bleeding after menopause is also a concern, since it may be a sign of endometrial cancer. Colorectal cancer can cause gastrointestinal bleeding. Think about what's usual for you, says Debbie Saslow, Ph.D., the American Cancer Society's chief of breast and gynecologic cancer in Atlanta. It's abnormal for a woman to spot between periods if she has never done so before. It may not be for anyone else. Saslow explains, endometrial cancer is a common gynecologic cancer. Over 3/4 of those who have it have irregular bleeding as an early symptom. Your doctor will take a thorough medical history and, depending on the timing of the bleeding, and other symptoms, will most likely recommend an ultrasound or biopsy. Number 5. Skin changes. Most of us are aware that changes in moles are a common sign of skin cancer. However, Daly advises that we keep an eye out for improvements in skin pigmentation. She also recommends having your skin tested if you experience sudden bleeding or excessive scaling. It's impossible to tell how long is too long to watch for skin changes before seeing a doctor, but most experts agree that it shouldn't be more than a few weeks. Number 6. Difficulty swallowing. If you have trouble swallowing, you could have already altered your diet to make chewing easier, such as switching to soups or liquid foods like protein shakes. However, according to Leonard Lichtenfeld, MD, Deputy Chief Medical Officer at the American Cancer Society, the difficulty may be a symptom of GI cancer, such as cancer of the esophagus. Expect the doctor to take a thorough medical history, and order tests including a chest X-ray or GI tract examinations. Number 7. Blood in the wrong place. Don't believe blood in your urine or stool is the result of a hemorrhoid, says Mishori. It may be colon cancer, says the doctor. Expect your doctor to query you and possibly prescribe tests, such as a colonoscopy, which is a colon examination to check for cancer. If a woman is menstruating, blood in the toilet bowl could be from the vagina, according to Mishori. If not, she advises, it should be tested to rule out bladder or kidney cancer. Coughing up blood should also be assessed. According to Mishori, one instance of blood in the wrong position does not indicate anything, but if it occurs more than once, see your doctor. Number 8. Gnawing abdominal pain and depression. According to Lichtenfeld, any woman who has an abdominal pain and is depressed should see a doctor. While some researchers have discovered a correlation between depression and pancreatic cancer, the link is not well known. Number 9. Indigestion. Women who have experienced indigestion, while pregnant, may recall how it worsened when they gained weight. Indigestion for no obvious cause, on the other hand, may be a warning sign. It may be an early sign of esophageal, stomach, or throat cancer. Before deciding which tests to order, the doctor will take a thorough history and ask questions about your indigestion. Number 10. Mouth changes. According to the American Cancer Society, smokers should be particularly aware of any white patches within the mouth or white spots on the tongue. Both may indicate leukoplakia, a precancerous disease that can lead to oral cancer. Request that your dentist or doctor examine your teeth to determine what should be done next. Here are a few more examples. A source of discomfort: people tend to worry more of different aches and pains as they get older, but pain, no matter how ambiguous, may be an early symptom of certain cancers, even though most pain symptoms aren't related to cancer. Pain that doesn't go away and isn't clarified should be investigated. Expect your doctor to take a thorough medical history and determine what, if any, additional testing is required based on that detail. Lymph node modifications: it may be concerning if you find a lump or swelling in the lymph nodes under your armpit, or in your neck or anywhere else, according to Linden. If a lymph node grows bigger with time and it's been more than a month, she advises, see a doctor. Your doctor will test you and rule out any underlying causes, such as infection, for the lymph node enlargement. If none exist, your doctor will most likely order a biopsy. Fever: if your fever isn't caused by influenza or another virus, it may be a sign of cancer. According to the American Cancer Society, fevers are more common after cancer has spread from its original location, but they may also indicate early blood cancers including leukemia or lymphoma. Jaundice or a shift in the hue of your stool are two other cancer signs. Expect the doctor to perform a thorough physical examination and obtain a thorough medical history before ordering tests such as a chest X-ray, CT scan, MRI, or other tests, depending on the results. Tiredness: fatigue is another hazy symptom that may indicate cancer or a variety of other issues. According to the American Cancer Society, it can occur after the cancer has progressed, but it can also occur early in some cancers, such as leukemia and some colon and stomach cancers. Cough that doesn't go away: coughs are common with colds, the flu, asthma, and are often a drug side effect. A cough that lasts longer than 3 or 4 weeks, on the other hand, should not be overlooked, according to Mishori. If you're a smoker, you'd expect your doctor to take a thorough history, examine your throat, check your lung function, and maybe order X-rays. Did you like our video? Tell us what you think about it in the comments. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.